Hi, everyone. Welcome to the fifth episode of the Public Health Podcast. We are Jonathan and Elvis from the Parker Public Health Club, and we're super happy today to be joined by Dr. Shan Lu. Dr. Lu is currently a professor of medicine at the University of Massachusetts and serves as a member of the Scientific Advisory Board at Multimeric Biotherapeutics. He received a $17.3 million grant to continue his HIV research, which is something that we'll be discussing today. So in this episode, we'll discuss Dr. Lu's journey in the medical field, as well as his breakthrough works in HIV and AIDS research. Dr. Lu, it's such an honor to meet you finally over Zoom and finally to discuss your research. Do you have any thoughts just to kick us off?
No, first of all, I'm very honored to be invited here. I always want to talk to students, stimulate the next generation's interest in doing more research or biological information or whatever. I think, we are living in a great time. Don't believe whatever other people tell you how hard life, the world is. It is complicated, but at the same time, there are huge opportunity. Technology, information, the future is just bright. So I want to share that sentiment to the young people, and certainly will be happy to answer any question you have. Because the problem is I'm old guy, what we think I like, what I feel important, maybe not what you want to know. So I don't want to just give you lecture or lesson. I want to hear what do you want to know. And also I can just say this as the introduction. You can find me anytime in the future. If you guys want to have follow-up or other student want to have a group discussion or follow-up question, I will be very delighted to spend any time I have to provide to you guys.
Yeah, thank you. It'd be wonderful if we could keep in touch afterwards so that we can have maybe our student body contact you if they have any questions about this podcast.
Sure,
Yeah.
absolutely, absolutely.
Mhm. And I also think that it's really great that I mentioned that because kind of at our school, a problem is that a lot of people are a little bit scared or intimidated by solidifying their choice of major or which field they want to go into because
Mm.
a lot of opportunities available. So I think it's very empowering that you did mention that we should just kind of trust the process a little bit and just don't be scared about making your
Yes,
yeah.
yes. May I ask you, what grade are you in right now?
So I'm currently a junior, so I'm in 11th grade, and I think Jonathan's in Jonathan's in
I'm a sophomore, so I'm in 10th grade.
Oh, that's good. You have more time to think about, to do more things. That's great. Okay, so at the end, certainly here I am to answer your questions, so I will be happy to do. But at the end, I certainly would like to know more about your school, your classmate, everything. Then I can find how to match your interests, other things.
sounds good. Okay. So I guess to kind of start off this discussion, we want to kind of introduce it with a little bit of a talk about COVID. So we
Yes.
know that in the past year, everyone's kind of been focused on COVID. A bunch of research has been focused into trying to develop the vaccine itself. How exactly has COVID impacted your personal life, or how's it?
Sure. Um, uh, the COVID, I think it's a very profound. First of all, it's one of the first major global, we call the name pandemic. It has a special meaning. If you just have a cold, or even you have a million people have a cold, that's not pandemic. This is pandemic, probably the worst ever in history, even worse than the uh, medieval time plagues or 1918 Spanish flu, even though that term is a little bit discriminatory, just like people talk about Wuhan virus. Okay, it happened first time, but place like this virus, Wuhan. Spanish flu is not even in Spain, United States, Europe, but people are very sensitive to those times, and the government will arrest you if you say it's U.S. flu or England flu. So that's how this is the misname there. Okay. But the impact of COVID is very big. I think you don't need me to tell you, right? You probably all study from home. You don't go to school or go to school, sometime, but not continuously. Your teachers, unions do not want to go back to work at school because they don't feel safe. Okay. And your parents, many of them probably don't have a job or don't go to work. Even they work through Zooms or Teams from home. And the city is empty. I don't know which city is closest to you. Los Angeles?
Uh,
Which,
San
huh?
Francisco.
yeah,
Los Angeles. So you can see Los Angeles, usually you are Highway 101, right? I know Los Angeles very well. There's a packed. Now you have nobody, not now, but in last year sometime. And the city is empty, like a ghost town. And this is horrible. Now you see what happened in India, right? People are dying in millions. So what happened is a virus coming. I think that the whole society worldwide, we are not prepared. Even though we talk about it, we should prepare for any pandemic like a major influenza. But to be honest, being a scientist, I feel our government, I say not just the United States, worldwide, there's nobody is well prepared at all. I think a politician, even some scientists, we think very naively, think of something, but never think about in this kind of situation. Okay, this virus, from a biology point of view, we will say it's a perfect virus. You heard the term called the perfect storm, right? In English, right? Even
right.
there's a movie, Perfect Storm. But this is perfect virus. Why? Because it's not so immediately dangerous like Ebola. You are even getting close, you will be dying, something. So 95% people or more will survive. 80% people, you don't need to go to hospital, but you will suffer 2 weeks probably. But at the same time, you don't know whether you belong to 80% or 95%, or you belong to the unfortunately 5%, you will die. And also you read a story, people like young people, usually they don't die, but you can imagine your parents, middle age or younger grandparent, older grandparents, they will die from nothing. And all of a sudden, without, any warning sign, you cannot even go to hospital to hug them. You cannot go to hospital ICU outside window, say goodbye. You can only use an iPad, iPhone to say goodbye. You can imagine, you are very young, you probably not experience a lot of tragic things in life, but you can imagine this is a eye-opening life experience, education, right? So it's not a fiction, it's happening everywhere. So this is, they are not too dangerous, they're too lethal, I would say. They are dangerous, they're not too lethal. So you're not touching the die, 100% people die. But on the other hand, they leave this unknown, but still the death rate is high. It's 10 times to 50 times higher than influenza. So that makes you a very tricky situation. You cannot take a precaution, otherwise some people will die. If you take a precaution, the society will paralyze. So this is the difficult part. So the world really responded very well, generally, but very uneven. Like in Brazil, the president does not believe that. In India, prime minister thought, oh, we did a great job, and now we can open, have a party, have all the river party, everything, people get together. You see what happened now. So in the United States, you can see, I don't have to tell you, you don't have to be on any political stand. And you can see we struggled, we get through. But almost worldwide, it is a test on human nature. Some people politicize it. I don't care whether you are red or blue, you're this part of it. It really should not. It is a disease, it's a virus, human. We should all unite together to see what's the solution. There are a lot of rumors, a lot of, called conspiracy theories, but we are not doing the right thing. And also even wearing a mask can be a political issue. Isn't that funny, right? So this is a
Yeah.
very, very ridiculous. And now we have a vaccine. Luckily, scientist. I'm a vaccine scientist. So I'm very happy to see my colleagues can develop not just one, it's multiple. Right now, there's about a dozen or so vaccine globally being licensed, several in United States, Europe, some in Russia, some in China, some in India, combined together. It's about 10 to 12 already. Within 10 months, this is shocking, unprecedented. So the science, biotechnology really showing the power, okay, and political power because government give a lot of money. Otherwise, they cannot move so fast, okay, whether US or Chinese or Russia, okay. So we are seeing the good part. If we work, we think smartly, we can do a lot. But at the same time, now you see United States, we see a huge drop of infection, huge drop of death rate. Why? Because we have vaccine. But we still see there are certain people, they probably will never want to have vaccine. So that's dangerous. So young people, you should first to tell your parents, your family, your grandparents to get the vaccinate, okay? Vaccine is not perfect. They do have a side effect, especially this newer generation, they do have a side effect. I can tell you, I got my vaccine. My wife got the vaccine. My mother-in-law, who is 95 years old, she got a vaccine. My son is like you. My son is much bigger, in 20s, but he just got, he waited in Massachusetts, have an order, so we did not try to jump ahead of other people. Massachusetts open to almost every, grown-ups. So he just got his vaccine yesterday, first dose. So we will get a second. So through all this personal contribution, so I test use my body, seeing this is safe. Okay, there are side effects. There are bad side effects. There may be people dying, but we don't know whether that's directly related to vaccine. Okay, even let's say some vaccine causes some damage. This is called the risk and benefit ratio. If you have several million people, just a couple people harmed by vaccine, that's acceptable from a society point of view, right? If we cannot even prove that's the case. Okay, so overall, I can see we already have, not just a few million, we have like a close to several hundred million, okay, half the country. So we know we did not see people, hurt by vaccine everywhere, right? So that's basic evidence. You don't have to read the CNN or Fox News or anything. You watch by yourself. So the vaccine is working. So we should get that, okay? And certainly we still need to be careful, especially young people. The next one will be young people, teenager and the college student, because you guys, get together a lot, okay? So that's next high risk population. I think that the company and the government already did the trial. We will have vaccine ready for you soon. So once that ready, please jump in to get there. So you have that, you can have more time to get together with your friend, your girlfriend, or your boyfriend. So, that's great. It's a protection, okay? And you can feel comfortable to see your grandparents if you don't live together. So this is a great thing we should do, okay? But of course, we have not win the war. That's going to be a long war because this virus is going to stay with us maybe a few years, maybe many years, okay? So we need to gradually build a system, vaccine, public health, and smart societies management. So we'll go back. I'm very confident we can go back to normal life, but with a precaution, okay? So that's what I think will happen. But anyway, I give you a very long, not introduction on it, but a lot of information already. So please, I will stop here, see what else you want to know. Yeah.
Yeah, I think that was super insightful what you said about about the pandemic and how the vaccine is super important. So now I want to transition into talking about your work. So my first question is for our listeners who are new to the field of biotech and autoimmune disease, could you quickly explain what HIV is?
HIV. Yeah. HIV is another pandemic. HIV is the pandemic of the 20th century. COVID-19 is a pandemic of the 21st century. Maybe not the only one, we don't know, okay? So HIV also, the origin is not very clear. probably from Africa, but we did see first a few patients in the United States, San Francisco, and being reported about 40 years ago. So it started with a certain population, gay and other people, not just gay, but the gay was among the first group to be discovered. So they quickly, scientists also very smart, find out that is, sorry, let me turn on this one, is a retrovirus. So HIV is a complete different virus from COVID. We did not talk about biology of the virus part, okay? So the retrovirus is scary because it's worse than this COVID. So retrovirus, especially HIV, they come in, this is a type of RNA virus. If you want to go back to study or ask your biology teacher, okay, or do Google search yourself. Both COVID-19 virus called the SARS-CoV-2 virus, okay, and HIV, the official name's HIV-1, okay. So this virus, both are RNA virus, but they are different. HIV is a retrovirus. That is, they exist, their genome, their genetic material is in the form of RNA, but they replicate, produce themselves, use RNA to reverse that into DNA, and then use DNA to guide this production of RNA, then RNA to protein, right? If you ever take a basic 101 of molecular biology, you see the genetic secret code is starting from the DNA to RNA to protein, right? So I don't need to go through detail, you study yourself. So HIV or retrovirus, they're smart. They exist the RNA, they reverse, that's why we call the retrovirus. They come back to the DNA and then come back to RNA and protein, okay? The two scientists discovered this because at that time, everyone thought, oh, that's not possible. We all know DNA, RNA, protein sequence, right? Not to reverse that. So two scientists got a Nobel Prize for that discovery, okay? The COVID-19 will stay as RNA. They replicate itself as RNA and then become protein, become virus, okay? However, the HIV is more scary because they infect us. In order for them to be the DNA type, stable persistence, they will integrate into our genome. So in other words, HIV infect us, they will stay with us forever. And they go into the most important cell in our body called the CD4 T cell. So they stay here. Your cell replicating 1 to 2, 2 to 4. The virus also become 1 to 2, 2 to 4 in all your cell, next generation. So you cannot get rid of that. That's why HIV is very scary. And HIV can cause disease. Some people can cause disease in a few years. Some people maybe a little bit longer. If without treatment, eventually they exhaust your immune system secretion, you will die. It's a very painful process, slow dying, not like COVID. If you die within 2 weeks, maybe a little bit longer sometime if a doctor try to treat you. If you don't treat you, you can die within 2 weeks or you never die. Then you recover, you're fine. You don't have a virus in your body. But HIV is different. You have only one outcome. You live with the virus, okay? So you always have the chance to die. But luckily, about 25 years ago or 30 years ago, so the scientists discovered an antiviral drug treatment, okay? So now people living with AIDS, they can be as close to normal people as possible, even though not fair to say, they still under such a psychological, cloud. Also, the drugs have a side effect, so it's not perfect, but at least they can survive. The big name in Los Angeles, you should know Magic Johnson. Do you know Magic Johnson?
Yeah.
You know. What does he do now?
I actually do not follow up, so I can't answer that question.
But what was his job before?
Before he's the infamous basketball player, correct?
Yeah, he's a basketball player. It's a legendary basketball player. It's like a Michael Jordan, Magic Johnson, almost same level, same time almost.
Right.
So Magic Johnson now is a rich man, very, very, maybe one of the richest, black men in the country. He owns a multiple sports team in Los Angeles. baseball and and those things. You go back to search on that. Okay.
Okay.
So you can see his life is very good.
Hmm.
You cannot imagine, 25 years ago, he almost will die. When he announced he has AIDS, the whole country was like a shaking. Okay. So,
Hmm.
wow. Okay. But luckily, he got the virus not very early, not too late, of course, but luckily, not too long after he got infected, the magic drug being developed. So he has been living, generally very healthy, functional, become a big, owner of sports teams, plus I'm sure, plus other business.
Hmm.
So you can see this is a good example. So the success of biological science and drug development. Okay.
Okay.
So if you ask me, so HIV, that's it. And HIV still does not have a vaccine. So I have been devoted my career in the last 20 years to develop HIV vaccine. It's very complicated because a highly publicly important product. But on the other hand, we work at HIV field. We are not lucky have the support like a COVID-19. The whole world government, throw a lot of money going there. So AIDS research, we don't have that kind of support. We do have a lot of support. So I'm happy my team is one of the leading team develop HIV vaccine. So my actual vaccine is going through human studies. So that's where they are. So I'm hopeful maybe someday we can develop one. Yeah. But at the same time, there are other novel therapy or prevention method to reduce the chance to be infected by HIV. Okay. So,
Right.
and
Okay. Yeah. Thanks for like the super clarifying answer. Just to like kind of summarize what you said, what I can take away is that there's a wide range of viruses that you mentioned. HIV is a retrovirus, and SARS-CoV-19 is just a separate virus in and of itself. But I think if we're connecting it back to like, for say, public health, I think the response to both of them when they first came, like the response to COVID and the response to HIV, were both similar in the fact that like people started realize that like after a little bit, oh my God, this was such a big issue that we need to like put in our research as well. But in the beginning, I think there was, like you said before, the response was, although a little bit inadequate, overall the response from like the global government was a really pretty good response overall. I think why if we can make that comparison is like being able to see how our response power as well as like how our capabilities as like a country has changed over time. So I think that was a really insightful comment that you so far.
yeah, I think you touch a very important point. Okay. I think, as you said, the virus is everywhere. There are many viruses we don't know. So I think from a general public, because we cannot blame or kind of accuse individual citizen, because the number one responsibility is for government or public health organizations, NGO or scientists. We should get more accurate and information available to general public. Okay. But at the same time, when the HIV happened or COVID-19 happened, I think overall the world is quite prepared to address that initially. For example, when HIV come out, very quickly people identify that was some virus, which was a mystery, okay, for a while. And also COVID, within like 2 weeks, 10 days, people in China even cloned the virus, sequenced that. So this is no problem. So technical basic things, we are better and better. The real challenge is actually public health. So we need to believe science, okay? And the politicians should believe in science. Don't twist the information, don't politicize, because your responsibility is huge, because the public citizens will follow your information to make their own personal life decision. For example, HIV, for quite a while, South African leaders, they refuse to acknowledge HIV caused AIDS. So then how would the citizen to respond to prepare, to prevent such infection? in United States, there are people kind of refuse that to take the public health measures, okay? So those are all humans. Very strange to me, the responses. From the beginning, the science, the biology is very clear. We tell people what the level, this and that. Certainly everyone say, I have my own freedom of a decision, yes. But on the other hand, you need to know your decision has to be based on educated, informed basis rather than stupidity. Because not only you are hurting yourself, your children, your family, you're hurting society because you will spread the virus. So that's why in HIV, in COVID-19, it's the same thing. They transmit it by different way, but we need all to learn. For example, how do you want to prevent HIV, right? So you need to have all kind of precaution when we don't have HIV vaccine. For example, you want to make sure you know your partners, whether they are high risk or low risk, HIV, and how do you prevent sexual transmission of HIV, for example. So many other things. So you can see that this is all very important, okay? So
Yeah.
anyway, I hope this is helpful to you.
Mm-hmm. Yeah, 100%. I think what you said about promoting transparency as well for the general public was really important part because, as you said before, initially our government response kind of was in denial of the virus, or they kind of underestimated the virus we have. And carrying on into what we see today, there's a lot of people still out there who kind of view, as you said, wearing masks as like this kind of political issue, where like their concern for public safety is a little bit kind of overwhelmed or like covered by their kind of selfish desire to not inconvenience themselves with wearing a mask. So I think being able to look at our past, being able to look at the HIV virus as well as the COVID virus to be able to kind of grow in the future, I think that in general is a really good step in the correct direction in just improving our public health response in general. Yeah. So on that note, kind of we wanted to dive a little bit deeper into your specific research within HIV vaccines. And we heard that you have like this novel prime boost method. Could you go a little bit more in depth about the specific mechanisms behind that?
Oh, very interesting. You really are very knowledgeable now. So what I did was I was one of the early inventors of DNA vaccine. Now you heard the mRNA vaccine very popular, right? The Pfizer, Moderna, that kind of thing. So actually DNA vaccine was, I say, the big brother. mRNA vaccine was a little sister, but now sister is more successful than the big brother, but they all belong to the same category called the nucleic acid vaccine because DNA, RNA in the same category from a chemical point of view. So when we started DNA vaccine about 25 to 30 years ago, the animal work data was outstanding, but then we quickly moved to human study and people realized they are not doing so well. So people split, scientists. Some use gene gun, electroporation. For example, I was a leader in gene gun. There are people nucleic electroporation. And then the people also use narrow particle, lipid stuff. But we found out all these things come together has its own issues. For example, gene gun or electroporation, you need other fancy equipment that become not practical when you go to Africa or everyone need a shot, right? So not so easy as a needle injection, like right now we are doing 100 million doses. So the RNA people also has their own problem. So they modify the RNA structure, become less toxic. They also use a narrow particle, which is very strong. That's why the side effect is pretty bad, but it's tolerable, okay? So they move that direction. But again, this time the COVID-19 for vaccine is an easy target because people can self recover, right? So that means your immune system is easy to be generated. But HIV, as I said, is different. From, infected, you can be very long. So how do you generate strong immune response? Immediate prevent, that need a much higher immune response than COVID-19 vaccine. So from the beginning, when I use DNA, I found that DNA alone is not strong enough. that's why I combined the DNA and protein. And we found that this could be a very major scientific discovery. So we use DNA to prime and protein to boost. So basically, you say you have two weapons. Nothing is perfect, but you combine the two weapons, you can cover all different aspects, okay, from immunology point of view. But they deliver the same antigen, okay, same immunogen. So DNA code for DNA sequence once in our body produce the protein or antigen is same as the protein. You just need to deliver antigen in different way. Somehow our body has a T cell and B cell involvement. This is a magical combination discovered by accident, okay, by me. So that's how we found the heterologous. Heterologous means not matched, because when you were young, going through, your parents will tell you, you receive many vaccinations. Some are new ones, some are boosting your original immune system when you are a baby, okay? So that's the same. We will call them homologous prime boost, okay? But here it's a heterologous because they are different format, different type, but they are the same antigen, okay? So this is a completely new concept, heterologous and new. So I invented this, use DNA protein. Then later we realized you can have, different kind of combination, DNA or even mRNA prime, probably same. The boost, you can use a protein, you can use the inactive virus or live virus, or you can bacteria. There are many differences depending your pathogen. So this has become an open, exciting area. So I use this approach, have generated the best immune response in HIV vaccine in 40 years. So we just have new data. Next week, I'm going to present at the HIV vaccine trial network. It's a government network in a national, international meeting. But at the same time, after the discovery of mRNA coronavirus vaccine, COVID or inactive vaccine, for example, in China, so the inactive vaccine is not very immunogenic. It works. So that's why the Chinese scientists recently, they also did a prime boost. Okay, you see news, the magazines called The Scientist. It's a trade magazine. And yesterday, Radio Canada just interviewed me. The other day, MIT News interviewed me. They all talk about heterologous prime boost because we know the challenge currently facing COVID-19 is very huge. Some country can only have this vaccine. Some population may only have this one. So the question, can we combine together to do that? So this is a very hot area. So my original discussion, very basic science, very HIV oriented, now being used by COVID-19. So you can see Russia, they have not exactly heterologous, somewhat is. They use different serotype of virus. One is ADA5, one is ADA26. They use a prime boost. In some way, it's the same idea, okay? So in China, I'll be happy to send you the paper, published on my journal. I'm an editor-chief of a journal called the Emerging Microbes Infection, okay? So we published that. The Chinese scientists from China, FDA, they combined the mRNA protein inactive vaccine and what else? Adenovirus. So they have a different combination, prime boost. Not all can be prime, not are the best for boost. So there are some, science to control that. So, but we learned a lot from this. So the prime boost is a huge opening. So myself also did the DNA protein approach to a coronavirus vaccine. I'm teamed up with a Chinese company, a public company in China. We are developing this vaccine. We published a paper too. Our vaccine will go to human in China very soon. So this principle, I think, is going to be very powerful.
Yeah, 100%. Just to kind of summarize, because I think you did talk a lot about like specific mechanisms within the research. From what I can tell, there's different kind of, I guess, triggers or stimulants that kind of trigger this immune response. And as you said, there's like there's a DNA virus, there's RNA virus, there's an inactive protein of the virus that you can use in your body to trigger all of these immune responses. And the difference between your approach versus the current approach is that when we're administering these vaccines where you usually have a first and second shot, right? Where the second shot's the boost. You're using two different kind of types of vaccines within the same kind of strategy. So in your first shot, you get DNA, and then in the second shot, you get the inactive protein. And then what you found was that the combination of these two, and maybe like the change in your immune response, maybe the number of antibodies in your body, that increased because of this in comparison to maybe, as you said, the homologous or same immunogen response, that you found like a lot of difference and success in comparison to that. Is that a general good summary?
Yes, yes. In other words, we can say no vaccine is a perfect vaccine. So vaccine type A has a strengths, but also has some weakness or shortcomings. So vaccine B also have some strengths and some weakness. If you combine them to use that, you get the benefit of both vaccine and minimize their shortcomings. So that's the basic idea.
Sounds good. Okay. Then, Jonathan, do you want to ask the last question?
Sure. So given all the progress with the HIV vaccine over the last couple of years and where you are today, where do you see HIV vaccine technology in 10 years from now?
Right. It is very hard to predict because we are moving and pushing very hard, but the barrier is very huge because, as you know, like a COVID in China, very hard to do efficacy trial because if you don't have cases, you cannot do in China. So China vaccine has to go outside to test the phase 3 efficacy. For HIV, we don't have many HIV cases in the United States. We have to go to Africa. So imagine going to Africa to do a large trial. It's very difficult. You need a lot of money, a lot of infrastructure and management. So this is a huge challenge. So we have to work with various partners or stakeholders, government, NGO, private company, and globally different country, everyone chipping, and the countries, local organizations, people in Africa, or maybe Thailand, and other places. So it's a huge, massive project. But I'm happy to see not just the technical part, but in terms of this organization, we are making solid progress, my team. So I hope if we are lucky, 10 years from now, we should have HIV vaccine. But this is the rate of success, the probability is actually very low because of so many barriers. But I'm determined I will continue to push this forward. Yes.
Got you. That sounds really good. And I think carrying on kind of like the theme of this conversation we've had so far, it's a little bit about just making sure we don't make the same mistakes that we have in the past and just continuing to build off like current research, making things more transparent to the general public. And I think collaboration in general among like the different governments around the world, pulling in our resources and information to be able to respond to such maybe a pandemic or even a small scale virus in the future. Yeah. So I think that concludes all of our questions for today. Just to end off this discussion, do you have any words of advice that you want to give to our listeners, like you said in the beginning, who want to maybe enter the field but feel a little bit scared or intimidated by the idea of research?
I think for the young people at your age, whether it's senior, junior, or sophomore, I think your future is very bright. Okay. You don't have to do that biology. I know I see several Chinese kids here. I did not ask your background, or your school. I know many Chinese parents want their kids to be doctors. Myself is a doctor, a practicing doctor. I went through US training and get a license, even though I graduated from China's medical school many years ago. My wife also is a licensing doctor in the United States. So our family is a medical family. Even her parents, my parents, some of them were doctors, Western doctors in China many years ago. But we don't want to just emphasize my son to go to medicine. He does not. He does very well other things. So I think you should not afraid to explore your, whether doing biology, or I can tell you, my son went to college, go to take a major in history. So you should really open up to do anything. I think whether you were born in this country or you brought in immigrant to this country, I think this country in the world, it provide a very unique opportunity, even relative to Canada, relative to Japan or East, Western Europe. This country, one thing offer you is the opportunity. Okay, so treat the biology, the field, as one of many opportunities. If you really feel fascinated about the biology, please join us. Whether eventually you want to be a doctor or you continue the biology research, like some famous Chinese scientists, not born here but grown up here in the country. Dr. Zhang in MIT, he discovered the CRISPR, but he continued never to be a doctor, but he just become a biologist. Okay, so biology is hard. I don't want to mislead you. The research is hard. It's taking a lot of time. So the key question is you need to enjoy yourself. Once you get in, you need to know what is the key question, why you're doing. And there are many things. So if anything, I would suggest you is to find a good mentor, find a laboratory, and who really does biology research, whatever, is a very creative, very pioneer or the leading scientist in the field. So you don't want to just take a biology because my parents or Dr. Lu or someone else say there may be a future. So actually, there's a huge, proliferation of a biology major. Every college do bio major, but the quality changes, dramatically. Some school does not even have a lab, or have a lab is a very superficial. So I would suggest you, if you like biology, not just taking courses, but to go to labs. From high school, you can go to laboratory, UCLA or all the other hospitals, UC Irvine, whatever, UCSF, UC San Diego, many top-notch, California, you have so many top-notch state university. You don't need to go to fancy Ivy or anywhere. Or you go to biotech company. There are so many biotech company in California. So go there, starting from nothing, just dishwashing and doing basic thing, to go in, to get the feeling, get the flavor, what the biology is. Some people may change mind immediately after 2 hours. Some people getting very hooked into that. This year I go to this lab, next year I go to another one. That's become fun, really doing well. Ask a good question, but you needed to be associated with smart people, good mentor, good professor, good biotech leader, because in those groups, you will find smart people in the teammate, in the lab. They will stimulate you. Okay, that's very important. Don't in biology, because the question is long. It's not like a physics, mathematics, or chemistry. You can see that right away. So anyway, what I suggest you is to really learn the substance rather than just think, what's my job? Okay, because don't worry, if you are smart, I think everyone is smart. Especially, I can see you guys have a club here, exploring. So you are very, very dedicated. You are curious. Curiosity is the number one thing in life. Okay, no matter how young, how old, as long as you have that attitude, you can search for biology today. Tomorrow you can change it to law. The next day you can change it to social service. Next day you come back to biology, whatever. Doesn't matter. Just do things really, not follow the flow, not just follow because so and so told you, because you see that. You just do. You can go to LA, Hollywood to learn the movie industry. You can do streaming. You can do many things. I think the beauty of the 21st century, people are saying, oh, the world is broken, everything. But actually, I feel optimistic. This is a huge opportunity, including the United States. So enjoy, find, true love, which is hard to find. You need a time, gradually, but allow yourself for making mistake, but to keep asking, exploring. That will be my advice.
Yeah, I completely agree. And like, I really love what you said about having the freedom of choice and just having a really earnest interest in a specific area of study that you want to pursue. Because I think like most occupations in the world, being good at it or becoming good at it is a specific kind of like very technical process. And being invested in it emotionally, as well as like having this genuine interest, would definitely help you have fun throughout this tough process and will
Sure.
alleviate a little bit of the burden. Yeah. And I think at our school specifically, with like, we have the kind of the privilege to enjoy, as you said, like the benefits of the 21st century, where we kind of have the freedom to choose. I'd like to also encourage like our listeners to don't be afraid again to step out of your comfort zone as well, to try out new things. You never know what's there for you, and to just take on life with like looking up, real head up high, and just a general having the confidence to try something. John, did you have anything to add, or do you want to just?
Yeah, I think that was a super insightful what you said, and your words of wisdom about not just following in the footsteps of others, but really doing what makes you happy and what you enjoy. And so, with that, I think we can wrap it up. So, Dr. Liu, we really appreciate you coming today, and it was great to have you speak to us. I'm sure that all our listeners at the Harvard community and me personally have learned so much from your talk, as well as from your amazing perspective. And thank you again for stopping by, and we hope to keep in touch with you in the future.
Thank you very much. And you have my best wish to you. I wish I'm at your age. Then I can start do very different thing and enjoy. But I'm still learning every day in my career. I keep learning things. I'm exploring new things. Don't Today is not time to talk of my life, but I can tell you I'm studying many new things right now. So I just feel there's a huge opportunity for everyone, truly for everyone. So I just wanted to share with you. You will be fine. You will be great. So just enjoy. Thank you.